If you developed anxiety, brain fog, or low mood around the same time that your gut problem started, you're not imagining it. And it's not psychological. It's how chronic gut dysfunction changes brain signaling and how your body decides where energy gets spent. Mental symptoms often follow gut symptoms. That connection is real. Anxiety can start to show up out of nowhere. Brain fog begins to set in. Moods become flattened or even erratic all over the place. Motivation tends to drop off. And many individuals will start to question themselves when they're seeing or acknowledging that this has happened. They assume that it's unrelated, not initially making the connection to the gut. Maybe they blame stress for why this happens. But clinically, this pattern, it's extremely common. And especially when we start talking about SIBO. Hey guys, if I haven't had a chance to chat with you before, I'm Dr. Arland Hill. I'm both a clinician and a rancher, so I see both sides, the physiology and the food. And the question I want to answer today is this: why do gut issues like SIBO change how people think, feel, and show up mentally? This pattern that I'm sharing with you, it's not theoretical. It's very well recognized, and there's now an umbrella term that encompasses this. It's known as disorders of the gut-brain interaction. And that terminology is important. That name matters because it reflects a shift in our overall understanding of what's happening in the gut and how it's connected to the brain. It illustrates that this is not just simply a structural issue, it's not simply psychological, and it's not just driven by food. It is a true communication issue between the brain and the gut. The brain, of course, being part of our nervous system, and the gut being our digestive system. But that connection matters, and the acknowledgement of that connection matters. And when you start talking about how SIBO affects mental health, this is why SIBO sits right in the middle of this overlap. And it explains so many aspects of why anxiety fluctuations can happen, how brain fog can just continually worsen over time, and why mood changes are set in, but yet they don't match what the labs show as what's going on sometimes as well. So they're not directly correlated. Focusing on the overgrowth makes sense by the name SIBO, small intestinal bacterial overgrowth. But SIBO is not just an intestinal overgrowth. It's usually framed up all around those bacteria overgrowing, but that's not the whole story. Yes, those organisms are growing where they shouldn't be, but clinically framing up around the overgrowth is incomplete. SIBO is not, I mentioned these disorders of the gut-brain interaction, SIBO is not on that list. But, and this is a big but, it interacts with the same systems that define the conditions that are on that list. Which is why when you start talking about SIBO, it mimics IBS. A lot of overlap there. It worsens functional bloating. It's going to overlap with food reactions, and it can fluctuate with things like stress and sleep. But treating it as just a bacteria is missing the broader system that it disrupts. And that name of disorders of the gut-brain interaction shouldn't be overlooked, even though technically SIBO is not on that list. Here's why this signaling between the brain and the gut matters. Chronic gut signaling can keep the brain in a threat mode, and that affects the entire body. The small intestine, think about that as a very highly sensory organ. It picks up a lot of information and it communicates it elsewhere, in this context back to the brain. And when you're dealing with chronic distension, fermentation, and discomfort, as you often see with SIBO, that sends constant signals back upstream. It's telling the brain that the digestive process is not working optimally. And there's the interpretation by the brain that this is a threat signal, if you will. What happens is the brain registers that as a threat, and it shifts into more of a vigilant state throughout the whole body, more of an on guard state. And that's where you can start to see the manifestation of things like anxiety. You'll get poor stress tolerance as a part of this. And over time, the brain begins to adapt more to that state of stress because it sees that that is becoming more of the norm and literally begins to over time function differently. So the communication between the brain and the gut is not the same as what it would be in an optimal state. The body prefers to operate in patterns, and it is literally doing what it does best. It is adapting to the pattern that it is seeing in that state of SIBO. This is why many times individuals with SIBO see that their motivation, their drive often begins to collapse. And it doesn't just stop there. You often see that many people with SIBO, it's not just about the lack of motivation or just the anxiousness. They're going to see some overlap in other areas as well. Maybe they feel flat or apathetic, just not interested in things. They could be erratic or moody, unmotivated, I mentioned, or just unable to initiate any type of action to do the things that they need to do. And this isn't about someone's specific personality. It's certainly not about someone being lazy. It's your body trying to tell you and signal to you that there's a bigger problem. Many individuals will find when it comes to motivation that they know they're a motivated individual and all of a sudden they're going through a period where their motivation just seems absent. This is a dopamine miscommunication. And dopamine, we often tie that to pleasure, to motivation, but this is bigger than that. It's also about what we could think about as energy allocation. Where are you redirecting your energy resources throughout the body? And dopamine helps the brain decide what's worth effort, how much energy can be spent towards that, whether the action is even possible. And when you tie gut dysfunction or layer gut dysfunction on top of that, which is going to increase the inflammatory load, it's going to strain nutrient signaling and availability, it's going to disrupt how the energy producing centers in the cells, the mitochondria, how efficient they are. When all of this gets disrupted, dopamine signaling, the efficiency of that begins to fall off as well. And it's not because the brain is broken in any way. It's just because the system is, because of this state of what's going on and these altered signals, the system is trying to conserve energy is what's happening. And it's trying to manage that altered signaling that it's not accustomed to seeing. Now, there's a piece of this conversation with dopamine that's not often talked about, and it is that when you look at dopamine, dopamine signaling is tightly tied to your mitochondria, to your energy-producing centers. And dopamine neurons in and of themselves are among some of the highest energy demand cells in the body. They require a lot of energy output. So when your dopamine signaling is impaired, you find that your cellular energy production declines. You just don't get the stimulation to the mitochondria. From that, your motivation begins to fall off. Your mental stamina, your brain energy begins to fall off. You perceive that as brain fog. And dopamine breakdown, if you acknowledge that when that molecule breaks down, it's actually supporting energy production at the mitochondria. When that goes offline, now the mitochondria is not getting what it needs from that breakdown of dopamine. This isn't about the body giving up in any way. Literally what it's doing is it's downshifting to try to survive because it's having more difficulty making energy, so it's going into a conservation mode. And this is going to look like a reduction in ambition, in planning, and what we would call your executive function, your decision-making ability. All of that begins to decline, the inability to want to push forward and do things. Those things start to go offline. What this actually means is that when SIBO affects the gut for a long enough period of time, or you're in a cycle of relapses, you get better, you relapse, you get better, you relapse, the brain doesn't just notice that. It literally starts to adapt to that. And it changes how priorities, like how things are prioritized in the body. It changes energy conservation, which I alluded to. It decides what actions in the body are even possible or where resources want to be directed to. And that adaptation process that I'm talking to you about, what that actually looks like day to day is anxiety, low mood, erratic mood, loss of drive, mental fatigue coming along with that. But understand that this isn't your brain outright malfunctioning. It's the brain responding logically to the persistent gut stress signals that it's taking in. And that problem isn't something that you want to think about as, well, what's wrong with me? That problem is you want to look at, what do I need to do to get unstuck from this protection mode that I'm in? It's a physiological adaptation that you're in that hasn't been resolved yet. And this is why when you start trying to willpower your way through it, forget it. That's not going to work. You're not going to willpower your way past your body's own physiology. Positive thinking, that's great, but it's not going to fix what we're talking about. What's going to fix this is changing the way that the brain receives these signals and the signals that the brain is getting. That's what's going to shift this. And that starts by understanding that SIBO, yes, it is a gut condition, but it alters brain function. And those two are going to feed back and forth, and only looking at one side of that equation. This is why I said earlier, if you're just looking at SIBO as an overgrowth, you're missing it. You've got to see the full loop that's playing out. And when you do that, the next step, well, it becomes obvious. Stop thinking about SIBO as just an intestinal overgrowth. Start viewing it as a bidirectional condition where gut dysfunction changes brain function, but that change in altered brain function is also going to further impact gut function and behavior. So with SIBO, the gut affects the brain, and the brain in turn affects the gut. And healing starts when you address both sides of that loop, of that feedback system. If SIBO has changed how you feel mentally, you're not imagining it, and you're certainly not alone. Understanding this connection often removes unnecessary fear. And if you want to understand how diet choices can quietly worsen this gut-brain stress and what actually supports repair, well, go ahead and watch the next video, Why a Healthy Diet Can Still Damage the Gut, Protein and Gut Repair Explained.